Borderline personality disorder, or BPD, is a psychological condition that has been misunderstood, stigmatized, and all too often misdiagnosed. Imagine living in a world where your emotions seem to shift like sand dunes in the wind, unpredictable, uncontrollable, and overwhelming. This is the world many people with BPD navigate every day. BPD is a complex disorder characterized by intense emotional experiences, unstable relationships, and a deep-seated fear of abandonment. But what makes BPD so difficult to identify is its ability to masquerade as other disorders, depression, anxiety, or even bipolar disorder. This misdiagnosis can lead to treatments that don't address the root of the issue, leaving individuals trapped in a cycle of confusion and despair. So how does BPD develop? The roots of BPD are deep, often stretching back to early childhood. Research suggests a combination of genetic, epigenetic, developmental, social, and environmental factors contribute to its development. Genetically, some individuals may be predisposed to emotional sensitivity, making them more vulnerable to developing BPD. Epigenetic changes, alterations in gene expression triggered by environmental factors, can further exacerbate this predisposition, particularly in response to chronic stress or trauma. Developmentally, experiences of inconsistent caregiving, emotional neglect, or early life trauma can lay the groundwork for BPD. A child who grows up feeling unsafe, unloved, or invalidated may develop a fragmented sense of self, leading to the profound identity disturbances that characterize BPD. Socially chaotic environments, abusive relationships, or peer rejection can compound these issues, pushing the individual further into emotional turmoil. But why is BPD such a problem? The answer lies in its pervasive impact on nearly every aspect of life. People with BPD often experience intense emotions that can shift rapidly, leading to impulsive behaviors and unstable relationships. Imagine feeling overwhelming love one moment and profound hatred the next. This emotional roller coaster is exhausting and can lead to severe relational conflicts. BPD matters because it fundamentally affects a person's quality of life. Those with BPD often struggle with feelings of emptiness, shame, and self-loathing. They may engage in self-harm or suicidal behaviors as a way to cope with their emotional pain. This disorder doesn't just affect the individual. It reverberates through families, friendships, and communities, creating a ripple effect of misunderstanding and hurt. What does BPD look like in everyday life? Picture a person who is fiercely loyal yet constantly fears being abandoned. They may oscillate between idealizing and devaluing their loved ones, leaving those around them confused and hurt. This push-pull dynamic is a hallmark of BPD, driven by an overwhelming fear of rejection. The symptoms of BPD include emotional instability, sudden and intense mood swings that can last hours to days, fear of abandonment, an intense fear of being left alone, leading to frantic efforts to avoid real or imagined abandonment. Unstable relationships, a pattern of unstable and intense interpersonal relationships, often characterized by extreme swings from idealization to devaluation. Impulsive behaviors, engaging in reckless activities such as spending sprees, substance abuse, or binge eating. Identity disturbances, a distorted or unstable self-image, often leading to sudden changes in values, goals, or career aspirations. Chronic feelings of emptiness, a persistent sense of being empty or void of meaning. Inappropriate anger, intense anger or difficulty controlling anger, often leading to physical fights or verbal outbursts. Dissociation, feeling disconnected from reality, which can manifest as out-of-body experiences or a sense of unreality. In one real-life example, imagine a person named Alex. Alex has always been described as intense by friends and family. They love deeply but are also quick to anger, especially when they perceive any hint of rejection. Alex's relationships are a series of highs and lows, filled with passion but also conflict. When things go wrong, Alex feels overwhelming despair, leading them to act out in ways that push people away. This cycle of idealization and devaluation leaves Alex isolated, reinforcing their deep-seated belief that they are unlovable and destined to be alone. The ongoing ramifications of BPD are profound. People with BPD often feel misunderstood and stigmatized, which can lead to social isolation and further emotional distress. Families may struggle to understand why their loved one behaves the way they do, leading to strained relationships and a breakdown of support systems. How do people cope with BPD? Unfortunately, many cope in maladaptive ways, through self-harm, substance abuse, or by withdrawing from others. These strategies may offer temporary relief but ultimately exacerbate the underlying issues. Some may try to hide their symptoms, presenting a facade of normalcy to the world while struggling internally. For families, understanding BPD is crucial. Providing a stable, supportive environment where emotions are validated and boundaries are respected can help reduce the emotional intensity that fuels BPD behaviors. It's also essential for families to recognize that BPD is not a character flaw or a choice, but a complex mental health condition that requires understanding and compassion. BPD can significantly hinder a parent's ability to provide a quality life for their children. A parent with BPD may struggle with emotional regulation, leading to inconsistent caregiving, which can impact the child's sense of security and emotional development. Children may feel confused by the parent's unpredictable behavior, leading to their own emotional and behavioral issues. So, what are some practical ways to cope with and heal from BPD? Developing mindfulness practices, engaging in self-reflection, and building a support network are essential first steps. It's also crucial to learn and practice healthy boundaries in relationships, recognizing and addressing triggers before they escalate. Over time, these strategies can help individuals with BPD manage their emotions more effectively and create more stable, fulfilling relationships. If trying on your own doesn't work, you might want to consider exploring professional help. Therapy, particularly dialectical behavior therapy, DBT, has been shown to be highly effective in helping individuals with BPD develop better emotional regulation and interpersonal skills. As the philosopher Friedrich Nietzsche once said, "He who has a why to live can bear almost any how." Understanding BPD gives us the why, and with that knowledge, we can find the how to navigate its challenges and move toward healing.